The drug that most men are shocked can lead to infertility are the alpha reductase inhibitors. In men of the older age group, they are used to reduce the size of the prostate, resulting from a condition known as benign prostatic hypertrophy. But the same drug, being finasteride, being used at a lower dose, is used in male baldness. Now, as you know, many men, even from their late 20s to their 30s, start to lose hair. And that is very bothersome for some of them. And so many have been on finasteride 1 milligram for a long period of time. It has not only prevented further hair loss, but for some, it has stimulated hair growth. So many men have continued to use this drug year after year after year, some even decades. The drug works by blocking the conversion of testosterone to dihydrotestosterone, and this hormone is absolutely crucial for normal sperm cell development. Another drug of this class is known as dutasteride. Next on the list, we have anti-epileptic medications, would you believe? So the valproate and carbamazepine. These reduce sperm count, sperm quality, and the motility of the sperm cells. Antipsychotic medications that are used to manage conditions like schizophrenia or bipolar disorders are culprits for causing infertility in men. The drugs that belong to this class include risperidone and haloperidol. These drugs increase the prolactin levels, and high levels of prolactin has a knock-on effect on the negative feedback loop, leading to a reduced production of the testosterone hormone, thereby causing reduced sperm cell production. Some anti-ulcer medications, like cimetidine and ranitidine, will affect the hormonal balance, leading to low sperm count and poor sperm cell mobility. The immunosuppressant known as cyclosporin, which is used to prevent the body from rejecting a transplanted organ, can also affect fertility. But usually what tends to happen is that when cyclosporin is stopped, the sperm count returns to normal. Non-steroidal anti-inflammatories, would you believe, more commonly known as Nurofen or ibuprofen. The long-term use of these for conditions like rheumatoid arthritis or any other inflammatory conditions that may benefit from these non-steroidal anti-inflammatories will lead to infertility by suppressing testosterone production, leading to an overall hormonal imbalance. But thankfully, the low sperm count that results from long-term use of non-steroidal anti-inflammatory usually is reversible. Blood pressure medications like the beta blockers, for example, atenolol, and the thiazide diuretics like benjofumethiazide. Long-term use of these drugs leads to erectile dysfunction and inevitably a low sperm count. Thankfully, also with these drug classes, it is reversible. So stopping these drugs after 3 months, you should start to see your sperm count come back to normal. But if you don't know that these drugs affect your fertility, especially because controlling your blood pressure is so important and it prevents other pathologies from developing, you will continue to take these drugs whilst making a futile attempt at falling pregnant. Recreational drug use also affects fertility in men, and this is how the different types of recreational drugs affect fertility in men. That is it for this video. I hope you've enjoyed it and that it has been informative. Remember, if you are on these medications and you are considering stopping them, knowing what you know now, it's important that you don't do it on your own back, that you take the information back to your doctor, discuss what can be done, and then be guided by your own doctor.